The purpose of the underhand volleyball serve is to begin the game and to begin a new set after a point has been earned by either team. Also, the serve is intended to make the opposing team's offense as difficult as possible. There are 5 phases to the volleyball serve, and they are the stance, preparation, movement, follow-through, and lastly, the recovery phase. Throughout these phases, we will be utilizing a variety of joints, and they are the scapulothoracic, glenohumeral, proximal radial ulnar, distal radial ulnar, hand, spine, hips, knee, ankle, and the foot.
Stance phase, upper extremity. During the stance phase of the underhand volleyball serve, the right scapulothoracic joint is engaging in upward rotation isometrically. The right scapulothoracic joint is also engaging in upward rotation isometrically. The left and right glenohumeral joint are engaging in flexion and its muscles are working isometrically. The left and right elbow are flexing isometrically as well as supinating isometrically. The left and right wrist remain in a neutral position. The wrist flexors are working isometrically. The left and right hand are flexed isometrically as they get ready to prep for the underhand serve. The lumbar spine remains neutral as the stabilizer muscles work to keep a strong posture. Some muscles include the erector spinae and the quadratus lumborum. The left and right hip also remain neutral, using muscles such as the iliopsoas and the tensor fasciae lata to keep a stabilized position. The left and right knee are both neutral through extensors isometrically. The left and right ankle are both engaging in plantar flexion isometrically as the feet are planted firmly on the ground. The left and right foot are both neutral through extensors, acting isometrically.
Preparatory phase, upper extremity. In the preparatory phase of the underhand volleyball serve, the scapulothoracic joint is retracting concentrically on the right side using the middle and lower trapezius as well as the rhomboids. On the left side, the scapulothoracic joint is engaging in upward rotation isometrically as it helps keep the arm up to hold the volleyball in place. The muscles used are the middle and lower trapezius and the serratus anterior. The right glenohumeral joint is extending concentrically using the teres major, latissimus dorsi, lower pectoralis major, and deltoid posterior. On the left side of the body, the glenohumeral joint is flexing isometrically as we prepare for the serve. The muscles that are used are the anterior deltoid, upper pectoralis major, and the coracobrachialis. The right elbow is extending eccentrically using the triceps brachii and the KNES. The left elbow is flexing isometrically using biceps brachii, brachialis, and the brachioradialis. The left elbow is also supinating isometrically using the biceps brachii, supinator, and the brachioradialis. On the left and right side, the wrist remains neutral. On both the left and right side, the hand is flexing isometrically. The muscles involved are the flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus. In the lower extremity, the lumbar spine is neutral as the hip, knee, foot, and ankle are doing most of the work to efficiently prepare for the full movement. The right hip is extending concentrically as the subject prepares for the serve using hip extender muscles such as the gluteus maximus and the biceps femoris. The left hip is flexing concentrically using the hip flexor muscles such as the iliopsoas and the rectus femoris. The right knee is extending concentrically using knee extensors such as the rectus femoris. The left knee is flexing concentrically using knee flexors such as the biceps femoris and the semitendinosus and semimembranosus. The right foot is engaging in plantar flexion concentrically using flexor muscles such as the gastrocnemius and the soleus, and the left foot is engaging in dorsiflexion concentrically using flexor muscles such as the tibialis anterior and the extensor digitorum longus.
Movement phase, upper extremity. The right scapulothoracic joint starts at retraction and goes into upward rotation. While retracting concentrically, the pectoralis minor is working as well as the lower trapezius. While engaging in upward rotation, the serratus anterior and trapezius are working concentrically. On the left side, the scapulothoracic joint is engaging in upward rotation concentrically. The glenohumeral joint on the right side is extending and moves into flexion as the volleyball is being served. Both the extensors and flexors are working concentrically. The glenohumeral joint on the left side is using upward rotator muscles concentrically. The right elbow is using extensor muscles concentrically and then moves into extension and supination concentrically as well. The left elbow is using flexor and supinator muscles concentrically. The wrist, both left and right, are remaining neutral in an isometric position. The left and right hand are in a flexed position, engaging in the volleyball serve concentrically. Movement phase, lower extremity. The lumbar spine is doing minimal movement in this phase as it remains neutral while the stabilizers are working to keep an upright position. The right hip is engaging in left transverse pelvic rotation, rotating concentrically as well as extending concentrically. The left hip is also engaging in rotation and flexion concentrically. The right knee is using extensor muscles eccentrically, while the left knee is using flexor muscles concentrically. The right and left ankle are using plantar flexor muscles isometrically. The left and right foot have neutral toes through extension, using the extensor muscles for the foot.
Follow-through phase, upper extremity. The scapulothoracic joint on the right-hand side during the follow-through phase is using the upward rotator muscles concentrically. The left side is using downward rotator muscles eccentrically. The glenohumeral joint on the right side is using flexor muscles concentrically, and the left glenohumeral joint is using extensor muscles concentrically as well. The elbow on the right side is extending and supinating concentrically, and the left elbow is extending concentrically. The wrist remains neutral as it engages in isometric contractions using flexor muscles. The right hand is using flexor muscles concentrically. The left hand is using the extensor muscles concentrically. Lower extremity. The lumbar spine remains neutral as it engages in isometric contraction using the stabilizer muscles. The hips are engaging in left transverse pelvic rotation. The right hip is using extensor muscles concentrically, and the left hip is using flexor muscles concentrically as well. The right knee is using extensor muscles as it concentrically contracts, and the left knee is using flexor muscles as it concentrically contracts. The right ankle is using plantar flexors isometrically, as well as the left ankle. The foot remains neutral through extension for both the left and right foot.
Recovery phase, upper extremity. The scapulothoracic joint on the right is retracting concentrically as well as using downward rotator muscles. On the left side, similar movements are happening as there is concentric retraction and downward rotation eccentrically. The glenohumeral joint on the left and right are both using flexor muscles concentrically. Both the left and right elbow are extending concentrically. The wrist on the left and right both remain neutral using flexor muscles isometrically. The left and right hand are flexing concentrically using wrist flexors. Recovery phase, lower extremity. The spine continues to remain neutral as it uses stabilizer muscles to contract isometrically. The abdominal muscles are contracting concentrically and the lumbar extensors are being utilized isometrically as well. The hip remains neutral and uses the iliopsoas to remain in isometric contraction. The right and left knee are slightly flexing concentrically. The ankles both remain neutral through plantar flexors isometrically. The foot remains neutral through extensors and isometric contraction.
Stance phase summary. The scapulothoracic joint on the left and right are both engaging in upward rotation on a sagittal plane about the frontal axis. The glenohumeral joint is flexing on both sides on a sagittal plane about the frontal axis. The elbow is flexing on a sagittal plane about the frontal axis. The elbow is also supinating on a transverse plane in the longitudinal axis. The wrist remains neutral on the sagittal plane about the frontal axis. The hand is flexing on a sagittal plane about the frontal axis. The spine, hip, and knee remain neutral on the frontal plane about the sagittal axis. The ankle is engaging in plantar flexion on the sagittal plane about the frontal axis. The foot remains neutral on the frontal plane about the sagittal axis.
In the preparatory phase, the scapulothoracic joint is performing retraction on the right side in the sagittal plane around the frontal axis, and on the left, upward rotation is occurring in the sagittal plane around the frontal axis. The glenohumeral joint on the right is extending in the sagittal plane around the frontal axis, and the left is flexing in the sagittal plane around the frontal axis. At the elbow, there is extension occurring on the right in the sagittal plane around the frontal axis, and the left elbow is flexing in the sagittal plane around the frontal axis, as well as supinating in a transverse plane around the longitudinal axis. At the wrist, on both the right and the left side, it is remaining neutral in the sagittal plane around the frontal axis. The hand is flexing on both sides and a sagittal plane around the frontal axis. In the lower extremities, the spine is remaining neutral in a frontal plane around the sagittal axis. At the hips, on the right side, extension is occurring in a frontal plane around the sagittal axis, and on the left side, flexion is occurring in the frontal plane around the sagittal axis as well. The right knee is extending in a frontal plane around a sagittal axis, and the left knee is flexing in a frontal plane around a sagittal axis. The ankle on the right side is performing plantar flexion in a sagittal plane around a frontal axis, and the left ankle is performing dorsiflexion in a sagittal plane around a frontal axis as well. Both the right and the left foot are remaining neutral at this time in a frontal plane around the sagittal axis.
At the scapulothoracic joint, on the right side, there's retraction moving to upward rotation in the sagittal plane frontal axis. On the left-hand side, there's upward rotation occurring in the sagittal plane frontal axis. At the glenohumeral joint, the right side is moving from extension to flexion in the sagittal plane frontal axis, and the left side is flexion occurring in the sagittal plane frontal axis. At the elbow, movement is occurring from extension and supination, occurring in the sagittal plane frontal axis and transverse plane longitudinal axis. On the left side, there is flexion and supination occurring in the sagittal plane frontal axis and transverse plane longitudinal axis. At the wrist, it is remaining neutral, but movement is occurring in the sagittal plane and frontal axis on both sides. At the hand, the right side and left side are both flexing in the sagittal plane and frontal axis. The spine is remaining neutral on the left and right side as the body moves in the sagittal plane and frontal axis. At the hip, there is left transverse hip rotation and extension on the right side, occurring in the transverse plane longitudinal axis and sagittal plane frontal axis. On the left side, there is left transverse hip rotation and flexion in the transverse plane longitudinal axis and sagittal plane frontal axis. At the knee, there is extension on the right side, occurring in the sagittal plane frontal axis, and flexion on the left side in the sagittal plane frontal axis. There is plantar flexion at the ankle on both sides, occurring in the sagittal plane and frontal axis. The foot is remaining neutral on the left and right side in the sagittal plane and frontal axis. In the scapulothoracic joint, it is uprotating on the right-hand side in the sagittal plane frontal axis, and downward rotation is occurring on the left side in the sagittal plane frontal axis. In the glenohumeral joint, flexion is occurring on the right side in the sagittal plane frontal axis, and extension is occurring on the left side sagittal plane frontal axis. The elbow is extending on the right side in the sagittal plane frontal axis and supinating on the right side in the transverse plane longitudinal axis. On the left side, it is extending on the sagittal plane frontal axis. In the wrist is remaining neutral in the sagittal plane frontal axis as well as the left side. In the hand, flexion is occurring on the right side sagittal plane frontal axis and extending in the sagittal plane frontal axis on the left side. The spine is remaining neutral as there is movement in the sagittal plane and frontal axis. At the hip, on the right side, there is left transverse pelvic rotation occurring in the transverse plane longitudinal axis, and extension occurring in the sagittal plane frontal axis. On the left side, there is also left transverse pelvic rotation occurring in the transverse plane longitudinal axis and flexion in the sagittal plane frontal axis. At the knee, there is extension on the right side in the sagittal plane frontal axis.
In conclusion, the scapulothoracic joint maintains retraction at a sagittal plane with a frontal axis and downward rotation with a frontal plane and sagittal axis. The glenohumeral joint maintains flexion, the elbow maintains extension, the wrist maintains neutral position, and the hand maintains a flexed position, all while in sagittal plane and frontal axis. The spine, as well as the hip, remain neutral with a sagittal plane and frontal axis. The ankle and foot also remain neutral with a sagittal plane and frontal axis. And the knee maintains flexion at a sagittal plane with a frontal axis.